Welcome to my session. My name is Erica Hagen, and I'm a fourth-year interior design student at the University of Florida. Hospitals are one of the most complex clinical areas within healthcare. Due to this, emergency departments are one of the most dangerous workplaces. Emergency department nurses experience a form of verbal or physical violence from patients and visitors weekly. Repeated exposure to violent events in the workplace leads to the increase of stress levels among workers, job dissatisfaction, that lowers the quality of care, and leads to burnout in many cases. The purpose of this research is to understand how the facility's design can minimize the risk of violence against healthcare workers and propose potential environmental design scenarios for future examination. After reviewing literature and multiple case examples of emergency department design, the case examples were categorized based off their spatial properties and possible vulnerability to violent events. From this point, 3 designs were moved into Autodesk Revit to create 3D scenarios to be used for future examinations. The focus of the spatial analysis is the relationship between the entrance, reception desk, the waiting area, security, and the triage rooms. The 3 design scenarios chosen for the video walkthrough were the 3 most implemented design layouts in emergency room design. These are from the perspective of the receptionist, security guards, clinicians, and walk-in patients. Environmental design contributions that studies suggest contribute to aggressive behavior are constant surveillance of patients by cameras, lack of privacy, and lack of visual access from the registration and waiting areas to clinical entry zones. Security concerns found at the entrance are also another source of concern. Studies found that visibility to the security station enhances the perception of safety and security. In the entry zone, the following design considerations can be implemented to reduce the risk of violent events. Reception desks with deep countertops and sloped sides to prevent violent visitors and patients from reaching over and harming staff. Shatterproof glass barriers at the reception to prevent a person from attempting to go over or to throw objects. Positive distractions to reduce stress, such as TVs, magazines, and other objects. Screens to provide up-to-date information. Comfortable and flexible furniture to alleviate physical strain during long waits. Comfortable temperatures, smells, and access to natural lighting. The scenarios developed in the study provide an opportunity for future examination and highlights the importance of interior environmental design in improving the security and reducing violent behaviors against healthcare workers in the emergency departments. Thank you for listening, and go Gators!